If we look at the model of the anterior abdominal wall, what we can see is that this is the anterior abdominal wall from the C-foot sternum towards the pubic symphysis, and we can see that these are the muscles that are forming the anterolateral abdominal wall, and this is the rectus abdominis muscle. So if we look at these muscles, what we can see is this muscle that has the fibers going downwards and medially. This is the external oblique. This external oblique at the midpoint of the clavicle, it becomes aponeurotic and it is going to form the rectus sheath. So this area covered is the rectus sheath. On this side, the rectus sheath is removed, so we can see the muscle. This is the rectus abdominis muscle. This rectus abdominal muscle at its different parts has intersections. These are the tendinous intersections. This point in the midline, this is the linea alba, and the point that is present lateral to it, all of this is the linea semilunaris. And this muscle, this is the internal oblique muscle. This is the umbilicus. This is also the linea alba. On its internal side, this is the umbilicus. This is the arcuate line, and as well this is the rectus abdominis. These transverse running fibers are of the transversus abdominis muscle. If we see here, this is the external oblique, this is the internal oblique, and this is the transversus abdominis muscle. If we see the structures that are present in the abdomen, first we have the liver, then this is the stomach, and after that this is the transverse colon, the intestines or the small intestines. This is the covering, that is the greater omentum. So if we take out the liver and we take out the stomach, what we can see is the structures of the posterior abdominal wall, and these include the pancreas. Anywhere if we put a point on this is the pancreas. This is the pancreatic duct that is moving towards the medial side. On the upper part of the pancreas, this is the splenic artery. This is going to be the transverse mesocolon. This is going to be the transverse colon, the tinea coli of the colon. This is the right colic flexure. This, all of it, is the ascending colon. Inferiorly, this part is the cecum, and we are going to visualize the appendix posteriorly. From here, we can see a posterior most part, that is the left colic flexure. We'll see it on the posterior side in a minute. If we see the posterior side of the same specimen, what we can see is this, the fatty part, yellowish part, is the pancreas. This is the splenic vein. This is the superior mesenteric vein that are going to join together to form the portal vein, and the inferior mesenteric vein that opens into the splenic vein. This is the superior mesenteric artery. This is the bile duct that is opening into the second part of the duodenum. This is the duodenum. This is the mesentery of the small intestine. So this is going to be the ascending colon. The ascending colon has the appendix on its posteromedial part. Posteromedial part of the cecum is the appendix. This is the ascending colon with the right colic flexure. This here is the left colic flexure and the descending colon. This part, the curved part, is the cecum, and after that will be the rectum and anal canal, which is not shown. This is the root of the proper mesentery. These are the structures that are seen in this model. If we look at the stomach, what we can see is this is the end of the esophagus, the lowermost part of the esophagus. This is the lesser curvature of the stomach, with this part called the incisura angularis. If we put a mark over here, this is going to be the fundus of the stomach. This, all of it, is the greater curvature of the stomach and the attachment of the greater omentum. This part is going to be the pyloric part of the stomach. Let us talk about the impressions or the identification points on the liver. This all of it is going to be the right lobe of the liver. Any point on this surface is going to be the right lobe of the liver. This is going to be the left lobe of the liver. Any point that is marked on this line is going to be the attachment of falciform ligament. On the superior surface, we have the inferior vena cava. This is the hepatic vein that is entering the inferior vena cava. This is the bare area of the liver with the superior layer of the coronary ligament, the right triangular ligament and the left triangular ligaments attachments at these points. If we look at the visceral surface, we are not going to mention the right and left lobes of the liver. Rather, we are going to mention the impressions and the main caudate and quadrate lobes. So, the impression on this part, posterior surface of the right lobe, is the impression of the right kidney. This part is going to be the bare area. We are not going to mention the impression over here because this is the continuation of the bare area. Alright, so this is going to be the right kidney impression. This is going to be the impression of the right colic flexure. This is gallbladder, body of the gallbladder. This part, the outermost part that is projecting out of the inferior border, is the fundus of gallbladder. This is the cystic duct. The ducts that are entering into the hilum of the liver is the hepatic duct, and after the joining of the cystic and hepatic duct, this is the bile duct. This is the hepatic artery and its dividing terminating branches. This is the portal vein and its terminating branches. This is the quadrate lobe of the liver. This white line represents the ligamentum teres. This is going to be the impression of the stomach or the gastric impression on the left lobe of the liver. This is the inferior vena cava and this is the caudate lobe. So remember, inferior vena cava also has a C and the caudate lobe also has a C on it. And this is going to be the fissure for ligamentum venosum. If we look at the posterior abdominal wall, what we can see is this is the terminal part of the esophagus. These are the suprarenal glands on both sides. You have to mention the side of the suprarenal gland. This is kidney. This, if we put a mark over here, this we will say is spleen. This is the hilum of the spleen with splenic artery and splenic vein present. These are the renal vessels. This will be the renal artery and this will be the renal vein. This is going to be the suprarenal vein and this is going to be the gonadal vessel, gonadal vein and the gonadal artery. This is going to be the ureter. Now all of this is present on the left side. So all of these are the left-sided vessels and ureter, kidney and suprarenal gland. These are the lumbar artery and lumbar veins. So the red one is the lumbar artery, the blue one is the lumbar vein. If we look at the abdominal aorta, what we can see is the superiormost is the celiac trunk or the celiac artery. This is the superior mesenteric artery and this is the inferior mesenteric artery. After that, this is the common iliac artery and inferiorly the internal and external iliac arteries. This is the abdominal aorta with the left renal and the right renal veins coming from it. This is the right renal artery. Now we look closely in the kidney. What we can see is this is the renal pyramid. This is going to be, if we put a mark just in the apex of this part, this is going to be the renal minor calyx. This part where 2 or 3 minor calyces are meeting, this is the major calyx, and this part will be the renal pelvis. After that, the ureter. This is going to be the renal cortex. Alright, if we come to the muscles, what we can see is all of this is diaphragm. The different crux of diaphragm, all of this. This muscle is going to be quadratus lumborum on both sides. Quadratus lumborum. This is going to be transversus abdominis. Transversus abdominis, then internal oblique and the external oblique muscles on both sides. Transversus abdominis, internal oblique, external oblique. This is quadratus lumborum. This muscle, the long elongated downward directed muscle, this is psoas major, and this is iliacus. This part is iliac crest. After that, inferiorly, what we can see is the median sacral artery. We also talked about the gonadal vessels, the right gonadal vein, the right gonadal artery. These are the structures that can be asked on the model of the posterior abdominal wall.